This particular patient wanted to have the amalgams removed, and she also wanted to have teeth that wouldn't break. So she wanted teeth that were the least likely to break possible without having metal. So we can see here that there's quite a few cracks. The patient has broken a number of other teeth, and we've got marginal breakdown. So it's possible that these amalgams would last a long time, but it's also possible they could break quite soon, or the cusps could. So we had a discussion with the patient, and she wanted to go with whatever I thought was the least likely to break anytime soon. Now obviously that would be gold, but in a patient who doesn't want metal, then gold's not really an option. So my next best option is full contour zirconia. Now you can see here that the patient is not really suitable for onlay. So yes, we could do an onlay. Okay, we've got some issues. The first one is she's getting recession. She has a thin biotype, so we'll probably continue to get recession. Will that be an issue? Well, we can see that there's plaque accumulating on the tooth here, and around the back of that tooth there was a little bit of decay, sort of up a couple of millimeters from the gingiva. So there's a few things. Secondly, if I do an onlay, it's going to need to come down here. So we'll have a bonded onlay finishing on the dentine margin. Now, dentine margins that are bonded tend to stain and break down over time. They can last a long time, but they generally stain. Lastly, this tooth, just because of the complex restorations, basically very difficult to do a bonded onlay here. If you're dead keen on it, you can, but it's just difficult because of the fillings here and here and here. So we decided that we would do a full contour crown, and when I have this sort of recession with thin tissues and I'm really wanting to cover all this dentine, my preferred method is the vertical preparation, or the feather edge, or the biologically orientated preparation. So they're all kind of versions of the same thing. So we prepped, did cores, and did the things. Now, when we go back and look at the preps here, what you can see is that down here at the margin, there's not much prep at all. Okay, so this area in the cervical part of the tooth is the bit where the tooth is going to fracture, if it's going to fracture. So removing tooth structure up in this area doesn't really affect the strength of the tooth that much. It's actually down in this area that's the issue. So we haven't really removed very much tooth structure. Now the other thing you'll notice if you look carefully at this picture is that the tooth tapers occlusally on all sides. Now this is important because when a tooth tapers towards the occlusion, it means that as tissue heals around it, it wants to kind of go up the tooth. Whereas if you have a tooth that's convex, so a bulging crown, then the tissue wants to go down towards the root. So convex shapes like this tend to be better at preventing recession. Also, you can see that with the vertical, because we prep into the tissue, we can go fairly subgingival, and so the combination of that tapered prep and the subgingival prep mean that if we come back later, it's extremely rare that we have recession. So normally when you do a chamfer-based crown, you can quite easily get recession, but with these sort of cases where you do the vertical preparation, you really don't. Now you can use many different burrs. I don't really care what you use. A lot of people think that the burr, I actually use a burr that no one else uses, which is a tapered finishing tungsten carbide, and I use that just because it's what I had in my kit. It's about the principle, not the equipment. So once we're seated, this is what we get. This is immediately afterwards. So we have a crown and the margin comes down to about here, and this one comes down to about here. Now, most other crown preps, in thin tissue like this, very high chance of actual recession, and by now, when the crown's going in, unless you do a temporary stage and then take your impression later and re-prep, very likely to end up with tooth structure showing. So that's one of the advantages of using the vertical preparation in these sorts of cases. Obviously, because all the occlusion here is flat, I've made this tooth flat to match, and I think this one probably doesn't have much occlusion. I'm not entirely sure. Thank you very much.